Welcome to the Medisun Podcast. Today we're joined by Doug Sandquist. He is a dentist out in Las Vegas. Doug, thank you so much for coming on.
Thanks for having me on.
I just want to start with a brief background on yourself and what you do.
Well, yes, I'm a dentist in Las Vegas. I've been doing this since 1998, so that's 27 years, I guess. A little bit about my background, I guess. I used to suffer from canker sores or aphthous ulcers as a kid. Those are those little white things that you get in your mouth, and sometimes you can get multiple of them. And usually most people think they're stress related, or some people think they're food related. I went to dental school. I remember sitting in dental school oral path class, and I wanted to find out what the root cause of these stupid sores are, because they would usually happen during finals week or something. And I had a fairly significant case of it. So I would get 4 or 5 of them at a time, and they would last anywhere from 10 days to 2 weeks, and it didn't matter what I did. Like they would never go away. So I put everything on them. So I was sitting in oral path class in dental school, and I'm trying to figure out, okay, when they came to that section, I'm like, I'm going to finally find the answer as to why these things occur. And the only answer I got was they're an autoimmune problem. So it's your body basically attacking yourself. We have no idea why, and the only treatment is a steroid. So that was the only answer I got for a aphthous ulcer, which then leads you to a realization that modern medical education and what we know is, if it doesn't look for the root cause very often, because they don't really know. So that kind of led to a few other little things down the road. So I actually ended up with another autoimmune disease. Ended up with celiac disease about 15 years later. So celiac disease is a disease of the gut related to wheat or gluten. So then as you start putting those pieces together, you start to realize that the GI tract begins at the mouth and it ends at the other end. It's a little bit crude, but the GI tract is a tube with 2 sets of lips. So that's pretty much what happens.
Yeah.
So I started putting those pieces together, and I started thinking about the problems with my celiac disease. And then once I started to treat that with improving my diet, most of my aphthous ulcers or canker sores, most of those went away. So that led me down a path of like, how do we heal the gut? How do we make sure that the gut is working as well as it could be? Then you kind of get into the research of the gut microbiome, and then you look in the oral microbiome, and then you start thinking about how these things all interplay, and how the body is all pretty much interconnected at some level. So then you start thinking, okay, so if the gut is bad, the gut microbiome's bad, the mouth microbiome is probably bad too. Like you can't really say that if one is good, one is, they are connected. So they actually do communicate. So then lots of research that shows that there are oral microbiome or oral microbes that actually do show up in heart attack victims. So the oral microbiome does cross the blood-brain barrier, and it does cross into the bloodstream. It's a known issue. So then, I really went into the world of the microbiome and kind of like the functional medicine world of supplements and things like that. And personally, I got a little bit better, but I still was having some issues. And then I met Max Gullhane, because there's my story there's another little off ramp to my story is, as a dentist, I've always been pretty curious as to back from my aphthous ulcer story. I've been pretty curious about the root cause of how things happen. So, the idea of like, how does tooth decay happen and how does gum disease happen? And so then the world of dentistry, about 10 years ago, we got into the world of sleep apnea and sleep, how people sleep. Because as dentists, we actually look at the tongue, we look at the maxilla, we look at the nose. Those are all in our wheelhouse. And there's things in dentistry we can do to actually make those things bigger. And so, if somebody has sleep apnea, they go on a CPAP, and the CPAP actually pushes air down their throat, opens up the airway, make sure they can breathe. So dentistry, we can look at these as these structures and say, hey, there's not enough room for air. So we've actually developed techniques over the last decade that we can actually expand jaws and grow jaws and break jaws. We can move them. We can make an airway bigger. The one thing that I've always thought about whenever we make an airway bigger is bones are always covered in soft tissue. And so if we cover bones with soft tissue and we're not really understanding what's happening to that soft tissue, we just make the bones bigger and we haven't solved the soft tissue problem. The soft tissue would just fill in the space. A very common thing that happens that most dentists will see, I mean, most lay people probably won't see this, but if somebody loses their teeth, which used to happen frequently in the past. But if somebody lost all of their teeth and then they came to the dentist, say 10 years after they lost all their teeth, so they had no teeth for 10 years, and they came to the dentist, there are not too many dentists that will be able to make them a set of teeth quickly. Because the tongue grows, the soft tissues grow, everything grows to fill the space that is not there. So that's a pretty known phenomenon that happens. So the idea that we can actually just expand the bones and not address the soft tissue, we will get some improvement for sure if we expand bones, but we have to, if we don't solve the soft tissue problem, are we taking 2 steps forward and 3 steps back? Are we going to land in the same place? And that's, in my mind, we shouldn't be doing major work without understanding where we're ending. So I had a few patients that they did some expansion, and that exact phenomenon actually happened. So then I'm trying to figure out that phenomenon, and I actually found Max Goldhain. He's a podcaster, and he's a physician in Australia. And so I was looking into visceral fat. So I was thinking, if you expand the jaws and we don't solve the metabolic issues, which can lead to visceral fat formation, do we get visceral fat formation in the tongue? In fact, I did just see there was a blurb on X the other day, like this one guy's, his hypothesis is that we begin to gain weight in the tongue. That's the first place we gain our weight. I need to fact check that. I'm not exactly sure, but it makes a little bit of sense. So I got into the world of the visceral fat world, and that's what I was looking at. I was looking at, can we measure it? Can we find it? Can we do MRIs to find out how much visceral fat there is in the back of the throat and the tongue? We probably can, but it was because of that connection that I found Max's podcast with Dr. Tom, the cold plunge guy, Tom Seeger, and that blew me away. And then once I started connecting the cold, and then I found Max's podcast with Jack, and then the first one he did on light was 3.5 hours. And that was the podcast that kind of got me into researching this and kind of thinking about how the light story is the first principle thought to how most of these things happen. So when you start thinking about autoimmune diseases, when you start thinking about all chronic diseases, it does start with light. And so that was my first introduction to Jack. And so the last almost 18 months has been pretty much knee deep into the light story and trying to prove it for myself, not just listen to Jack, and try to figure it out for myself as well as I can. As a dentist, I'm not a scientist. I'm still pretty much a everyday dentist. To say that I have it all figured out is probably, that's crazy, because I don't. So I'm just trying to figure out where we're at right now and how I can keep helping my family and myself get better, and then ultimately my patients get better.
That's amazing. And I think that's where a lot of people are at in this space, but it's kind of, it's eye-opening that it takes, a personal health issue typically to expand the mind and what you're looking at. I think a lot of people, not only dentists, but physicians as well, they just kind of almost, they're going through the motions a little bit to not look any deeper. So it says a lot about you that you're able to look past like just your basic, your basic job and what you have, and kind of see a deeper meaning. But like, what has that journey been like for you to open your mind up to these new concepts that were pretty much foreign to you before? What has that been like for you?
Well, you're a little bit of a unicorn, so that's the hard part. It's I think what you said about it takes somebody who has been to the doctor or about their issue, and the doctor says, I can't help you. It really, ultimately, that's the ultimate. For instance, like when I got my diagnosis for celiac disease, I had the biopsy. I kind of knew that was probably what the diagnosis was. So I spent 2 weeks before my doctor's visit. I spent 2 weeks just researching that disease and, pulling up every article you could, and, basically a crash course on what that was. I show up at my doctor's appointment, and we talked about it for about 5 minutes. And my doctor looked at me and he's like, well, you know more about this disease than I do. So have a good day. And I never went back. And so I totally understand how patients get to that point of like, I'm done. I have no trust anymore. I totally get how they get there. So, I think that was personal for me, and I didn't go back. So why would anybody else go back to us if we don't give them at least a forum to be able to talk about things and to at least try to see if they can, if we can help guide them down a better path.
Yeah, it's a little concerning that typically there's a pretty surface level understanding of a lot of these things, is what you realize once you go down the light rabbit hole. So how has it been dealing with other dentists Have you spoken to other dentists? Have you tried to kind of share this knowledge, and like how has it been received by colleagues and people of that sort?
Well, it's a significant yeah, it's not received well. It's a direct attack on their incentive. It's if you can okay, so this is an interesting way to think about it. So the people who are in the airway space who are actively, and that was my focus of my talks with Jack, was pretty much the sleep apnea world. Again, I don't treat sleep apnea myself, and we don't treat sleep apnea ourselves. We don't even diagnose it, but we're directly affecting. We have tools to do dentistry. We can actually improve the airway by just doing dentistry without it. You don't even need a diagnosis, but you can actually just say, upper jaw is narrow, for dental reasons, we can actually do these things. And then the other side of that is, hey, we may improve your sleep apnea, right? So that's kind of how it's used. And to be honest, I mean, there's even some sleep physicians who are actually referring over. And there are some patients who definitely need these treatments, or they for whatever reason their jaws never grew and they need to be expanded. So we need to be doing them. It's amazing that we actually have these tools available today. I think the problem is there's a subset of my profession that has now viewed that the growth of the jaws, and they've figured out the first principle, right? So they've figured out that the anatomy is the first principle. So for whatever reason, the anatomy didn't grow. So now we have the first principle thought that we can actually just grow the anatomy and we can make these people breathe better. And we have now been altruistic in our approach. Does that make sense? So the problem with that is that's not the first principle, right? The first principle is mitochondrial dysfunction, inflammation, and we have to solve those things along the way too. And so if we're going to start to address somebody's sleep problems and we don't address the circadian rhythm, we're kind of swimming uphill, right? We have the potential to have that patient. There's a reason there is some sleep apnea. There's some CPAP literature that shows that, 5 to 10% of the patients on chronic CPAP actually will get a chronic disease. So that's in the literature. So it's there. So if we know that's, people will say, well, that's a small amount. I mean, I don't know, 10% is 10%. So, and I think, the way I look at it is, obviously there are some people who I want them to get a sleep apnea diagnosis. I think they need to get it. And if they need a CPAP, they should get the CPAP. And if it's not working for them, then they start looking into other ways to try to reduce their use of it. And I think people can reduce through some of the lifestyle mechanisms, they can actually reduce their need for it. Weight loss and circadian rhythms is one of those ways to actually improve somebody's sleep.
It seems to be a recurring problem in all facets of health. Seems like there's a problem, and we're advanced enough to solve the problem, and then we learn how to profit off that problem, and then we're kind of stuck at that level. All this, like you said, you're kind of swimming upstream with this. You're not actually fixing what caused it, but you can play a little part in making it slightly better.
Right. A good way to look at it is, like, instead of, if you have somebody who has like a knee that's going bad, right? Instead of like talking about all of the things that they could do to actually prevent the knee replacement, they just say, "Well, come back in 5 years when you can't walk, and we'll just replace the knee." Like, yeah. Well, okay. Well, why don't we talk about all the different ways that we could actually maybe improve what's wrong there and actually delay that knee replacement for 10 years? Maybe 15 years, maybe never. How about spending every morning grounding in the sun, maybe get some electrons in the knee. Things like that. It's pretty simple stuff. It just goes against the incentive. And I think that's as Dr. Jack says, incentives always, dictate outcomes. I think that's ultimately the problem.
Exactly. And so
I don't think we're going to get away from that.
Definitely not. We're trying, but people like you are exactly what we need. People who are, a part of this system, who are realizing that it's deeply, deeply flawed. So when people come in, you talk about they have abnormalities in their facial structure. What do you think is preceding those issues and causing that improper facial structure?
Yeah. So the growth of the mid face is the major problem. So you can tie it down to a few things. You can think about food. So you can think about how we've decided to eat processed food over real food. So that's one idea. So that's where Dr. Jack will go after the food gurus, because the food gurus will talk about that it's the food problem. And most dentists will look at the Weston A. Price story or the Now, the carnivore guys will look at the Weston A. Price data so they think about all the kids eating, rib or whatever,
Yeah.
chicken. And then you think about like in the 60s and 70s, they process food to where we just pretty much eat, kids eat mush now and they eat little puffs and Cheerios. I mean, I ate Cheerios as a kid. I mean, you probably ate Cheerios as a kid too.
Yeah.
Because, mom was afraid of giving, a little kid a chicken bone, which is what they did 50 years ago.
Now it's like all applesauce packets and
Exactly,
squeeze things.
Squeeze,
That's what I see a lot.
Yeah, so people there's no, the food is an issue. But then Dr. Jack will say it's the light's the issue, right? So our modern world is now a blue light, stay indoors. If you're a pregnant woman today, I mean, you're pretty much told, stay inside. If you're going to go outside, put sunscreen on. You're going to be told, do X, Y, and Z. Play with their phones, their iPads, put their iPad or laptop on their belly. We all know about the non-native EMF story from Becker. When you look at the data from, I can't remember the guys, there's a paleontologist, archaeologist guy from Arkansas. His book talked about the Nubians that built the pyramid. They all lived outside, perfect jaws, well grown. 32 teeth. And the pharaohs had same problems we have now. So pretty much probably is a light story. The story as I see it, we know from there's some data from the myofunctional therapy literature. So myofunctional therapy is basically physical therapy for the tongue. So the myofunctional therapy literature shows that the tongue, it's called the frenum. It's a little attachment underneath the tongue. And that attachment is one of the last things that actually releases. There's something in the mitochondria that the mitochondria do is called apoptosis. So when we're in utero, our fingers are webbed, and then over time through apoptosis, our fingers split apart, right? So one of the last things that happens, and it's pretty common, I think 2 to 4% of the newborns are born with a tethered tongue, so they can't even nurse. So this is a problem in the nursing world, and so a lot of times they need to be released so they can actually grip and actually breastfeed. So it's a problem, but apoptosis is a function of UV light. So if you don't have strong UV light, apoptosis fails. Red light is necessary for autophagy, which is cell repair, and apoptosis we need UV light. If a mother is not really in the sun and it doesn't get strong UV light signals, apoptosis can actually suffer. So if you have a tethered tongue, what happens with a tethered tongue, the tongue stays down in the bottom of the mouth. If the tongue is in the bottom of the mouth, the upper jaw does not grow. So the tongue is supposed to be plastered to the roof of the mouth. And that 8 to 10 pounds of pressure that the tongue puts up there actually facilitates the growth of the upper jaw. So if a kid does not get his tongue up and he can't breathe, and it affects his ability to breathe, then you actually lose the size of the nose because the nose sits right above the upper jaw. So the tongue actually has to go in the roof of the mouth. So that's why Dr. Jack will actually say, why do we have to expand these kids' intervention when we put them outside in the sun, teach them a few things about putting their tongue up, and can we get the jaw to start growing? And so Dr. Jack would say, just put them in nature and nature will take care of itself. I'm not as optimistic that that's actually possible. I think it's going to take a pretty good parent to be able to do that. But I think some of these kids will need some intervention. But that's the reality of why the upper jaw is not growing. It pretty much comes down to most likely a tongue posture issue, environment issue. So then once the tongue is down, once that leads to mouth breathing, that leads to congestion, that leads to enlarged tonsils, that leads to, all sorts of other things that kind of leads to a cascade of a small upper jaw.
That's really interesting. And I see it a lot. I can see it just in people's facial structures. And I've spoken with Erwin LaCour about this too. And he's a breath specialist and he does a great job explaining the importance of it, breath holds, tongue placement. And I think it's a huge problem. And it goes back to what we were talking about before with people go in there. And I've had friends go in, they're like, I'm always congested. My airways feel blocked. And the ENT guys or whoever, they're like, oh, we just need to expand the sinuses. That's pretty much that's what they...
A Roto-Rooter.
Yes. And one of my friends actually just had that procedure done. And it just seems it's so surface level that's the initial treatment that you get is like a medical intervention before anything else. And how have you seen through your career, have you seen an uptick in this poor facial structure? The more people are inside, the more tech they're using, in the worse breathing habits people are incurring, have you seen an uptick in these poor facial structures?
Of course, yeah. I mean, there's probably, I mean, I would say, you know, majority of, you know, up to 50-year-olds have a deficient upper jaw.
Wow, wow, that's a lot.
Yeah. I mean, I think that actual the tongue data is that 20% of the population has a moderate to severe tongue tie. 20 to I don't know, 50% have a mild tie, and less than 20% have no restriction. I mean, it's a fairly significant um it doesn't mean that every single person with a moderate tongue tie needs to have an intervention, but it does, what it does mean is that a majority of those people probably do need some physical therapy for the tongue. And physical therapy for their tongue is probably the number one thing that could actually help benefit them. It's just what, again, this comes back to our whole, you know, earlier discussion. There are a certain group of people that want to be empowered to actually help themselves, and there are a group of people who are out there who say just roto-rooter my nose and then just make it better. So I mean, you can't force somebody to do physical therapy for the tongue if they don't want to.
Yeah, and
I have to understand it.
yeah, I think wisdom teeth is a kind of a not. It's a little bit similar, but I feel like I got two of my wisdom teeth taken out, and I remember specifically like I didn't even my teeth weren't shifting. They weren't painful. They pretty much just wanted to take them out. What is the actual purpose of wisdom teeth? And do you think people are taking them out way too prematurely? I know it's a big business, but what do you think the story is behind the whole wisdom teeth
I
epidemic?
mean, whether we were created or whether we evolved, we were designed to have 32 teeth. That was whoever or however that happened. I mean, the Anubians back on the plain building the pyramids had 32 teeth. So we had jaws big enough for 32 teeth. The problem is most people's facial structures and jaw structures aren't growing to the place to allow 32 teeth to fit. So if you happen to get jaws to grow 32 teeth, I think you should keep 32 teeth. I mean, I don't think they should just come out. The big problem that we see is if there is not quite enough room and you have those, say it's the lower wisdom teeth, and they're coming in say they're coming in sideways, and they do jeopardize the teeth in front of them. That's about the only time that I truly recommend that they should come out. I have seen some on the uppers that never came in. They just kind of stuck up there, and you have to kind of keep an eye out for those because they can actually get cysts around them, or they can have things happen around them that, it's not necessarily ideal. So kind of got to keep an eye on those. I've seen patients in their 80s with wisdom teeth that never came in. They're just kind of still up there on an x-ray. So, I mean, I don't think they've ever caused a problem. I don't think it's mandatory that everybody gets them out. I just think most people's jaws don't grow big enough to allow them to come in. And if they can't come in, then they actually create a problem too. So if they don't come in all the way, there's tissue that grows over them. You get infections around them, pericornitis. It's a nightmare. It's a pain in the butt for you and me. So sometimes it's better just to get them out so you don't have to deal with that. Sometimes it's kind of like tonsils. I mean, tonsils, there probably is a reason for them. But there's, for whatever reason, your tonsils are so big and you can't solve that, maybe they do need to come out or at least be reduced. I mean, I think there is a place for medical interventions. I mean, if you can't solve it. So not everyone's going to get their jaw to grow to get them in.
Yeah. And I think it's just the reality is that medical interventions are happening too frequently. And it's just like the easy way out and it's the most profitable.
And it's like, it really comes down to like a judgment call at some point. Some people say, well, if there's ever going to be a problem, just get rid of it now. Like, I mean, a friend of mine was it on Netflix? There's a movie on Netflix called Eden. And he was talking about how, I think it's just out right now. I don't even know the plot of the movie, but it was part of the story. It's like based in like the 1930s. And this guy moved to the Galapagos Islands, and, to prepare himself to move to this remote island, he took out all of his teeth just so he wouldn't get an infection. So, I mean, there are people who live in that world too. Like, if there's ever going to be a problem, I want you to fix it now rather than just see what happens. So, I mean, that's people will, again, it comes down to informed decisions, I guess,
Yeah. And I know it's pretty speculative, but what's your take on like root canals, removing teeth, and then that effect on the overall health of the individual?
Yeah, so I have it's an interesting, I have a little, maybe it's a nuanced approach to root canals. So in the internet, you will find in the holistic world, the holistic dental world will say that a root canal can never be fully cleaned. So it's a dead tooth inside that's living in the jaw. Well, that is, the nerve is gone. So the root canal is get an infection or a crack into the nerve and they take out the nerve. So they take out the nerve. There's a nerve artery or there's a nerve in a vein or a vessel inside the nerve. So yeah, if you hit it, the tooth will bleed. So the root canal will go and take the pulp out of the tooth and then fill it with an inert material. And so it goes back to, again, Weston A. Price and how he found all these skulls and found all these infections on the bottom of these root canal teeth. Most of his research was done in the early 10s and 20s and, before 1930. So our ability to clean teeth was a little bit more rudimentary then than it is now. I mean, we do have some pretty cool techniques in the endodontic literature to actually save teeth. Personally, obviously, informed consent, if a tooth gets to that place, you have two choices, either extract it or you do a root canal. There's really no other options. I actually think I push back a little bit on the idea that a root canal tooth is completely dead. When I went to dental school, Dr. Jack has actually we talked about this in my first podcast. There's the guy, when I was in dental school, I learned from this guy named John Leonora. And so it's called Leonora's flow. And so the idea is that the parotid gland is pretty much a signal that actually sets the flow through all the teeth. So the flow through the teeth goes clockwise. So it actually flows. There's a flow that goes through all the teeth. So if you look at a tooth, the root canal, and you have all these little channels inside the root. So that flow that actually occurs in a root canal, that flow still exists. So if you keep the flow going through, even with gutta percha, the flow actually exists. I now, after studying the world of quantum biology a little bit, I think the real reason that root canals don't really heal is just there's not a good flow and the light signal is bad. So I think if you happen to have a root canal, I think that just means you have to get more sunlight, more morning sun, more midday sun. And I think those have a better chance of healing if they don't, the ones that don't heal. I mean, there are some that don't heal, that won't heal. That is fact. So we know that. I think it's up to 10%. So if someone doesn't want a root canal, then that leaves you with either a space, which is perfectly fine. You can live without a tooth. Or it means a dental implant or a bridge. So there's, you have other alternatives, and each one of those has pros and cons.
So by flow, you're meaning like there's a flow of energy?
It's actually a flow of fluid.
Okay. Really?
Yeah, there's actually a flow of fluid. So and what happens is he actually showed that in that flow goes from, it flows out of the tubule. So it goes right down the tooth and then out. So if that flow is going in the right direction, it's actually taking everything away from the tooth. All right. He fed them, in rats, he actually fed rats high carbohydrate diets like Coke that actually reversed the flow. So it's actually a flow that actually, so tooth decay is really, it's a block of the flow as well. It's the wrong direction.
Wow. That's,
in addition to the bacteria and everything else. So it's kind of a two-prong approach there. So it actually is the flow of the tooth. So yeah, so if you drink a high, sugary drink, it actually is reversing the flow.
Wow. It would make perfect sense that something like grounding, getting sunlight would improve that flow and
all of it.
Yeah.
Yep. So Dr. Jack will actually say that the flow is directly related to the light signal. So if you're stuck, after dark on your phone, the blue light's actually reversing that flow. If you're in the grounding in the morning sun, you're actually getting the flow in the right direction.
Wow.
Which actually does make a little bit of sense.
Yeah, that makes perfect sense. Which is what I found with a lot of this stuff is that, I mean, a lot of these issues that, the modern medical models perplexed by, it's like there's actually answers to a lot of this stuff.
And I think the thing that's the most frustrating is that the prescription is so simple. The science behind it is so hard. So I think that's the challenge. And so it's kind of like what Rick Rubin said on Jack's podcast. It's like, I don't want to know the science, just tell me what to do. And so if we had more people like that, I think that would be easier. But I mean, people want to know why.
Yeah, I think that's a huge issue. And I had Zaid Dahaj, we just talked about this. Like, he feels like he's posting just the same stuff, the same information every day, and that it's so simple. But it's like, I mean, it kind of turns people off that it's so simple. It's almost too good to be true.
Right. It's like, what do you mean I just have to go get in the sun? And then they want to say, like, well, how long am I supposed to be in the sun? How long do I have to watch the sunrise? And how long do I have to keep my feet in the ground? And I mean, my typical answer is something is better than nothing.
Mm-hmm.
So if you give me 5 minutes, I'll take 5 minutes. If you can give me an hour, that's better.
Yeah. And I think a lot of people start to realize, like, it feels amazing. So it's not like a chore that you have to do. Once you build a habit,
Right.
I wake up and I'm like very excited to get outside, stand in the grass and view the sun. Like,
Me too.
it's like the best part of the day.
It is. And I never used to think about, the time change until I started watching the sunrise. And now I get really upset when the time changes because I'm into my flow. And what was it in the June? It was where I'm at. Sun came up like at 5:25 and now it's 6:07. And I know it's going to get closer to 7 o'clock and then it's going to go back to 6 o'clock. And I'm going to get upset about that again.
Yeah. And there's a lot of, I've seen a lot of stuff about poor health outcomes tied to those time changes. When you lose that hour of sleep and your circadian rhythm is thrown off, there's I think it's like a 15% increase in heart disease.
I think so. I think the heart attack data shows that around those times it does spike for sure.
Yeah. So and then it flips back when you gain the hour too. I think it gets better.
It is. And I think back to my colleagues, my colleagues will actually, when I talk about circadian rhythms, they kind of will laugh at me and they'll say, well, you just, want them to go view the sun. And, we're actually doing the real work. We're actually cracking jaws and I'm like, yeah, okay. I think, there's only so much you can say. I mean, it's not like I can't make anybody believe it. I can't make anybody do their research to actually get past their own incentive, if that makes sense.
Yeah. I mean, it makes perfect sense. And it ties right into Jack saying brain surgery without a scalpel. He realized you can fix a lot of things that you don't need to intervene with habits.
It's pretty cool. Like, I mean, when I start, I mean, I don't really have a huge social media following. I don't, I'm amazed that Jack actually would talk to me. It's wild to actually see people contact me like with their success stories of just from my 2 podcasts of how people have solved their own sleep apnea. And I think that's the rewarding part of it, is that people can actually get this information. And the thing that's made me realize is that my colleagues will never get it until they find a reason to try to get it. But I think the real people who are looking for answers, I think the normal people who are out there looking for answers will find the information, and those are the people that we really have to talk to.
I agree. And I think, I've listened to literally every single podcast Dr. Cruz has ever done. And I can always tell when he's like, when he talked to you, I can just tell that he loves the fact that you are a centralized dentist and you're now, expanding your mind. And I can tell it interests him. And that's why I love both of your conversations with him. They're great.
I mean, he was centralized too. I mean,
exactly.
He went through the same metamorphosis that we all do, right?
Yeah.
And he gets to the place where he's like, okay, so we did all this stuff and we're still, we're not really solving, and so does he have all the answers? I mean, probably not. I mean,
no one does.
You tell us that, a lot of it is a thesis, and we don't have the data. We don't have the information. We don't have the mitochondrial, data that we should, because we don't want to study it. It is interesting. There was a paper just released a few weeks ago, a couple months ago, that showed that the mitochondria actually signal when we need to sleep. So the signal to sleep is actually a mitochondrial function. So it's the mitochondria actually sense they get disordered, and really, the buildup of entropy or chaos, as I like to think about it. So that actually is the signal for us to sleep. And so if we don't get to there, sleep becomes an issue.
Yeah, and I think the centrality of the role that the mitochondria are playing is something it blows my mind that it's not changing as quickly as I would hope. Even Huberman on Bill Maher, he's like, the mitochondria, and he like puts in quotes, the powerhouse of the cell, and people are like laughing as if it's just some arbitrary thing,
It's
the
the thing.
central thing.
It's the central
And
thing of all of it. Yeah.
yeah.
And I mean, I think, yeah, it's the notion that it's just the powerhouse is pretty, I mean, that's pretty rudimentary that we've all learned in basic biology. That's
Mhm.
just I mean, they are so much more, there's so much more to what the mitochondria does. And I don't think, I mean, for instance, so my colleagues will, when I say sleep apnea is a mitochondrial disease, like they will laugh at me
Mhm.
like to my face. And they will be a little annoyed, right? Because, they may have a relative who has a quote true mitochondrial disease that, there are a few mitochondrial diseases that we do know about that are out there. But yeah, they can't connect the dots. They can't connect the poor mitochondrial function. So if our engines are running at 50% and they're not producing enough electrons, we don't have enough electrons, right? We don't get enough we need 4 electrons to make CO2 and water in every mitochondria, right? What are there? 2 to 5,000 or 3,000 mitochondria per cell, something like that. So we need all those enough electrons to actually get there. If we don't have enough electrons, then we create extra ROS and extra RNS, which are oxidative species, reactive oxygen species, reactive nitrogen species. Those are oxidants. That's the reason we take antioxidants, right? That's the reason that the world, like the people who drink pomegranate juice, is to reduce the oxidative stress. Oxidative stress is too much oxygen. So then if you have too much oxygen, that leads to inflammation, right? So I've heard Erwin LaCouri say, inflammation is flame, so that's fire. So inflammation is too much oxygen. And what happens when things get inflamed? They get bigger, right?
Yep.
So we actually grow. So if you think about sleep apnea and you think about the back of the throat, you think about the size of the tongue, you think about the size of the airway, the constrictions, that's inflammation. That's poor engines. That's the engines that aren't working. And so we actually have, and this is where Dr. Jack's thesis of sleep apnea comes down to, it's an oxygen allergy, right? So if you have poor functioning mitochondria who actually don't have enough electrons to make enough water, to make enough CO2 to expel, we now have larger tissues. We now have more oxygen in the system. And then we decide to add more oxygen. So then but I can't, I can probably a layman can probably understand that a lot easier than most of my colleagues can. I mean, you probably understand that better than most of my colleagues would understand that, right? I mean, you got
100%. Like in sleep apnea, Dr. explanation of sleep apnea was like, I don't know, it was so foundational to me. That was like one of the real first things where I was like, this makes perfect sense. The body's trying to literally protect you from excess oxygen,
right,
because you're an energy inefficient individual and you can't
right,
handle that extra oxygen.
right,
And then we just jam it down the airway.
right. And so that's actually why in the centralized world, I mean, I've seen Mary Bowden, who is a sleep ENT sleep physician. She'll actually say the weight loss is the number one treatment for sleep apnea. And of course, because if you can lose the weight, you're actually losing. And it's not about just losing the mass. I mean, okay, that's a piece of it, but you're actually improving the function. You're improving the energy system. What's really happening there. That's really the reality.
Yeah, exactly. It's not even necessarily the weight loss, like you said. It's just that you're becoming more efficient.
You're becoming more efficient, right?
Yeah.
And so you're using you have less cells that for the electrons you have, you're actually producing less extra oxygen is what you're doing.
Yeah,
Which
and
that's inflammation, right?
Yeah, and that's like during COVID, that's what Dr. Cruz talks about all the time. We just shoved oxygen in the system, and I remember vividly the call for ventilators, and then everyone started dying. Honestly, like I hate to laugh about it, but that's exactly what happened. It's just it really highlights the lack of understanding of our physiology from the medical system.
It does. And I mean, if you're a clinician interested in this, Nick Lane's book on oxygen is probably foundational reading. It kind of goes about the uniqueness of oxygen. So unique oxygen is necessary, but there's a reason that it's only 21% of our air. It's because we can't. I mean, was it us or the Russians who sent people into space with 100% oxygen and they all died? Right.
Yeah, heard that.
One of them, So I mean, I think more oxygen is not necessarily a good thing.
Yeah, and I think it's important to note that if you give your body the right signals, the right inputs, it knows exactly how to handle oxygen at the correct levels.
I mean, and the caveat to that though is there are plenty of people who they are actively, they do stop breathing at night. And so if you are that person and your wife is terrified that you're going to die, I mean, Reggie White did die. He did die from sleep apnea, so he didn't wake up. So that is a problem. So there are people. This is why I always tell I tell patients, go get a diagnosis, go get a CPAP, go get something to let's keep you alive for now,
and then work from there.
and then work from there.
Yeah.
I mean, and then if it becomes an issue for you, if it becomes an issue for you, then there are other ways. So I mean, I'll always tell somebody, go get a sleep study. I mean, I'm not gonna. I mean, I don't think everybody. I think you should go get a sleep study. I think people should go get. Let's keep people alive before we just tell them to go sit in the sun.
Yep. I agree.
I mean, I think people can start there, but I think if I don't want you to die in your sleep.
Exactly. And vitamin D is something that's, I mean, everyone knows that it's a hormone that's good for us, but it's specifically tied to dental health because of your calcium absorption. So how big of a role do you think that vitamin D is playing in our oral health?
I don't think you can heal. So if you have surgery, I think the dental implant world, failure is related to vitamin D levels. I know a few clinicians who actively measure vitamin D before they will actually do surgery to restore somebody or to put implants back. I think oral health is definitely related to at least some level of vitamin D dysfunction and vitamin D level. Now the question is, do we actually know if supplemented vitamin D is the same as non-supplemented? I don't know if we actually know that per se. I mean, I will say I think unsupplemented vitamin D levels they give you more benefits. And I think supplemented D levels can kind of give you a false sense of security. What's happening. I think I'm not a vitamin D expert, but that's kind of how I view it. I mean, my goal is to have a number as high as I can get it without a supplementation.
I think that's a good on that.
I think the cancer data kind of shows, supplemented D levels above 50 or 60 seem to be cancer protective. The supplemented levels don't really seem to show as much change in that. I think that's kind of how that goes. So that's how I look at it.
Yeah. And a lot of that is it's just a biomarker for sun exposure if you're not supplementing.
Yeah. And I mean, I think the other issue is there are cases of, I've seen evidence of supplementing, toxic, hypercalcemia, which is fairly significant. People can end up in the ICU with too much supplementation. You can take too much. Yeah. You can't get it from the sun. You can't overdose from the sun, but you can't overdose. People do end up, I mean, my wife just had a patient, in the ICU from too much vitamin D supplementation.
So your wife is a physician?
She is.
How is she taken to this?
It's interesting. She listens. I mean, she teaches at the medical school, so she's a centralized doc. So
yeah,
I mean, she listens. She listens. She tries to get out at sunrise. She gets out sometimes. She's working on it. So.
That's exactly who we need to.
It's not a complete
convert.
no. It's not a complete no at this point. It's like, okay, there's probably something to it. You know,
that's all you need. That's the start you need.
That's really where that's the And I, of course, like when I talk about centralized physicians, I have to be careful and try not to talk. I'm not talking about her because I mean, she's at least aware. She's at least aware, and she will. I mean, she's actually told some patients to go see the morning sun, like go put your feet in the ground and watch them. I mean, every single person can benefit from getting up when the sun rises, going outside and putting your feet in the grass and just watching the sunrise. I mean, even if don't even think about what it's actually doing, but just go enjoy the moment. I mean, that's really just the best way to start the day. You can, if you want to go down the rabbit hole of figuring out all the science of why you should be doing it, fine. But at the base level, just feet in the grass, watching the sunrise. Everybody should be doing that every single day.
I agree. And at the very least, you're just going to have the right cortisol. You're going to be more relaxed, less stress at the very base level.
Yeah, that's it. Well, the thing that drives me nuts is people, I've kind of gotten over it, but people ask me like, Doug, what red light do I need to buy? I'm like, none.
Yeah.
None. 365 days a year, you can go get your feet in the grass and watch the sunrise, and you get the best red light therapy you will ever have. Like there is no company can make you a better red light than that. And like
Yep.
if you have and I mean Bob Fosbury's work shows that you don't actually even need to be naked in the morning in the morning sun, because if you want a little more efficiency, if you have a stomach ache in the morning, take your shirt off. I mean, if you have a whatever, get your skin exposed if you need to, but you don't have to.
And I've heard Alexis Cowan talk a lot about those devices. A lot of them have flicker. They're like only a couple wavelengths of infrared. So they're expensive, if you want to get a real, like they're thousands of dollars.
And the other issue is the photobiomodulation research actually shows that you can do too much. So there's a window of when, you can't ever overdose on the sun. I mean, I guess, yeah. I mean, if I mean, I actually don't, I mean, a sunburn hurts, and I don't recommend them because it's painful. I think the melanoma research, there's a couple papers out of melanoma research because the idea that always the belief is that, melanomas are from previous, sunburns in your life. And
when you were 10 years old and now you're 80.
Now you're 80 and you got a melanoma. I think that there's a few papers that have kind of like made that kind of shown that that's not actually the case. I mean, people who had signs of previous sunburns seem to have better outcomes from melanoma. I mean, I think that was the way that kind of got turned on its head. I think the melanoma data is a little interesting when it comes to the sun. Zade is a good proxy for that.
Yeah.
But I think you really can't, if you're in the sun getting red light from the sun, you can't overdose. You can't overdo the photobiomodulation effect, but you can with red light. You should only do, 10 to 15 minutes. You shouldn't do it every hour. You should probably give yourself a break from it. If you're using red lights, you need to moderate that dose. You can do too much with those lights.
Yep. And that just tells us the same as the vitamin D supplementation. Like you can't overdo it with natural sun exposure, but you can with the cheap version of it, basically.
Exactly. Yeah. Yeah. If you try to make it simple or try to whatever you try to shortcut the system, you can. And that's actually the message of Jack. It's just, nature. Get back to nature. Stop trying to short circuit the system.
That's why he kind of hates the term biohacking, because
he does.
You don't really have to hack anything. You just do what you're supposed to.
Yeah. Basically, get out in nature and eat seasonally and eat locally. I mean, that's pretty much
That's it. And the one thing I did want to touch on with you was fluoride, and your initial opinion coming up centralized, and now your thoughts on it.
So I was raised in fluoridated water, which probably isn't the best thing. I'm going to say I have a little bit of a nuanced opinion on this. So if you think about fluoride from a biologic, when you think about fluoride, fluoride sits right next to oxygen on the periodic table, right? So it's oxygen and fluoride. Fluoride we don't need it in biology. So if we drink fluoridated water, if we consume fluoride, and this is the reason why it's a little bit controversial too, because there's really no research to show this, but just first principle thinking, if you have fluoride and it competes for the oxygen at the end of the electron transport chain, it can kick oxygen out, right? So if it kicks oxygen out, what happens to our mitochondrial function and our power, right? It actually degrades power. So then that can kind of make you think and put pieces together and say, okay, there's that paper that was released last year that drinking fluoridated water actually decreases our cognitive function, right? How much fluoride is necessary for that to happen? I don't think anybody knows. Jack would say any is enough, maybe. I don't know. Centralized dentists will say that we all know that too much fluoride causes fluorosis of the teeth, but they will also say that there's some evidence that it actually helps prevent tooth decay. I'm not quite sure that we can actually say that it does that much to actually stop tooth decay. Does that mean that I think everybody should stop using it? Probably. I don't think it's necessary. But there are some people that are just not healthy enough that we need to throw everything at them to try to save their teeth, if they choose to save their teeth, right? And you can educate and educate and educate, but some people will only do 10% of what you try to tell them to do. So for those people, yeah, maybe a high fluoride toothpaste will actually help save their teeth. I mean, I think to say to remove it from my armamentarium is a little, I'm not ready to do. Do I think there's other options available? Yeah, I do. The real problem with fluoride is the water. So most municipalities are fluoridating. Most people in the Southwest, you can't get rid of it. It's in the water already. So even if you're not using any fluoride at all, it's probably still in it. It's in medication still today, even though they say that's not, it doesn't, like if you do a search on like one of the AI Grok or Google, it'll say that it's not really, that it's bound. So if it's in your medications, then it's not a problem. I mean, okay. Like, do we know? I don't think we know. So yes, I mean, I mean, I'm a fan of knobs from Better Biome. I mean, I think Gator is a pretty solid guy. I think we have nanohydroxyapatite. It seems like it's probably a little bit better. Do we actually know? I don't know. Does it seem to remineralize teeth? Yeah. I think I still come back to knowing what I know about like mitochondria, mitochondrial function, and the flow we talked about before. Get in the sun, see the sunrise, eat seasonally, eat locally, don't eat a bunch of crap, don't suck on Coke every day, and that really ties back down to, it goes back to the Leonora's flow. So if we do that, and then doing those things alone, so what's interesting is so the microbiome, so the world of dentistry too has actually gotten into the world of probiotics and how do we measure the microbiome. And right before I found Jack, I was really into testing the microbiome, and can we test for bugs and find out what the bugs are, and can we target those, and yeah, we can do all that. Can we solve it? If we know what the bugs are, do we actually know how to eradicate those bugs and keep the other good bugs? I don't know if we know how to do that yet. I mean, I think I've tried, let's use these rinses, let's kill them, and then let's repopulate them with these. And is that really how nature works though? I don't really know. I mean, I tried, I found I had some effectiveness helping people, but it's kind of a hit and miss approach. I mean, I really think it comes back down to how do we get people to realign themselves with the sun and the light and go from there, which comes back to morning sun, midday sun, see the sunset, block blue light, and eat seasonally and locally. And I think that's pretty much the take home.
That's great. And I mean, my perspective is I try and avoid it. My teeth are healthy. So I'm like, it's not necessarily the toothpaste. It is like you're putting it in your mouth, but the drinking water is probably the bigger issue. Consuming it.
I don't think, I mean, obviously if you have a chronic disease or have something else, I mean, a dab of toothpaste might be an issue, but I think most people, I mean, don't swallow your toothpaste. I mean,
general knowledge.
You're gonna get some, transference, but it's such a small, tiny little amount. I mean, in comparison to the amount you're getting from other sources, I mean, it's probably, I mean, it's not, I don't know, it's not a hill that I'm ready to, I don't think it's a huge, if you stopped it, I don't think it's a huge issue. And I think if you had a little bit, I don't think it's a huge issue. Does that make sense? I mean, I don't want to be wishy-washy, but I mean, I try to think about these things on first principles and try to think about in the grand scheme of things, I mean, I don't think, yes, should we all be drinking deuterium depleted water? Should we all be, living at the equator? Probably. Should we, but we have to do the best we can with where we're at. And I think if we start there, then we can kind of start moving towards something better.
I agree. And that's the right take, I think. When Jack talks about it, he says it's the most electronegative element on the fluorine. So it's just stealing electrons. And if you think about the body as a whole, you want excess electrons, the more the better. So just first principles, it makes sense to limit your exposure.
Yes, I would agree with that. And that's the thought that's there. But again, I mean, every single patient is a little bit different.
And equals one, and it's
And I mean, it's like, okay, some people, it's like, okay, like we're already in negative, we're already in electron negative debt here. I mean, losing a few more is probably not going to matter at that point, So I hate to say that, but that's kind of like, that's where you're at. I mean, Jack would still do surgery on patients because that's what they need to do.
Yeah, exactly. I didn't want to take too much of your time today, but the last thing I would ask you is, where do you think not only medicine, but dentistry goes? Is there a decentralized caveat that dentistry can take? Do you think that's going to be something in the future that happens?
Maybe. I think the thing that's interesting about decentralization and what I've gleaned from Jack's ideas of decentralization, I think from a decentralized dentistry view, that really gets to the matter of you don't need us. So if you really get to the point of not needing us, you know, which will never happen because there will always be, injuries and there will always be other things that happen. But yeah,
We're going to drink soda and,
people are
like
gonna
it's going to happen.
well, Tommy's going to be playing baseball and it's like going to get hit in the face with a ball.
Yeah.
Well, it's very interesting. After my first podcast, I had somebody call me, to come see me because I talked to Jack, right? So I understood decentralized, and he calls me and he's like, "Yeah, I want to bring my family to see you," and it was pretty cool. And he's like, "But I know that you won't take X-rays, and I know that you won't." I'm like, "No, that isn't the way it works. It's like you can't I can't I have to do my job, and my job requires these things. And I understand that Jack will tell. I mean, X-rays are in non-native EMF. I mean, it is a problem. I mean, it is an issue. But I mean, do we live in a society where there's certain norms of what is acceptable and take care of patients, and that my board tells me that I have to do an exam on every single patient. So an exam requires me to look inside your mouth, and part of the exam is actually, in most worlds, it's taking X-rays. You can opt out of them if you can, but if you want to, don't recommend it. We've worked really, really hard to try to get the doses low. If you do think about it from a circadian system, I mean, having them done during the middle of the day is probably the best time to have them done, because that's when our body is used to having more radiation, right? Because that's when we're used to be out in the sun. So there is a circadian place of when you can have it's best to have your, X-rays taken. So this guy calls me and I'm like, well, no, you're gonna, and I said, ultimately, I said, if you want a decentralized dentist, I said, here's the reality. Like, if you're going down this road, you're going to try to take care of these things yourself until you can't, right? And the time you can't is when your little boy is playing baseball and he knocks his 2 front teeth out. And are you going to drive 4 hours to see me to have Johnny's teeth put back in? Or are you going to go find your dentist down the street that can take care of him?
Yeah.
I said, that's what decentralization is. That's go find somebody you're comfortable with that you can actually solve the problem like right now.
Yeah.
I think you went and found somebody close by. So I think to me, that's how I kind of think about it.
Yeah. That's the right take. And I agree, like if you take the full leap of faith, and then the theory is that you wouldn't even need a dentist. So you have to be partly centralized just to operate within the system. It makes total sense. But that's why I respect greatly what you're doing, because you're kind of finding different nuanced perspectives as you move through as a quote unquote centralized dentist.
Right. I mean, at least, so like a typical thing is like, there's a paper that came out, just the doctors the biggest thing doctors are worried about is misinformation amongst patients. It's like, okay, whatever.
Yeah.
I mean, I think we as clinicians, we have to fully accept and embrace that people can go on and read Dr. Google, and people can go and read about root canals, and people will go watch this podcast from me, and people will whatever, and they'll get their own opinions of them. And they come in, and I think we just have to be ready to answer those questions. I mean, you have to be able to answer the root canal question. You have to be able to answer the fluoride question, and realize that every single person's n equals 1. And sometimes it does actually make sense that, they should do X. I mean, that's if they're completely informed and they're allowed to make whatever decision that they can, maybe it makes the one that makes sense.
Yep. Completely agree. But I'll let you get on about your day. Thank you so much for coming on. I really enjoyed our talk. Where can people find you on X or Instagram or wherever you're posting?
Yeah, X just at Doug Sandquist, and on Instagram at Doug Sandquist too. I pretty much my Instagram is more photography than circadian biology, but it's all right. I don't really actually post. I don't post too much, but that's where they can find me. Reach out anytime. It's I can get back to you whenever if it's available. Yeah, I don't do this to get patients. I do this to spread the knowledge and to it's more an exploration of myself too, to try to figure out if I can learn it myself. And really, this is really just a journey. It's as much a journey to learn it myself as it is to change the world, or to, I don't expect to change my colleagues' minds. I don't really expect to change, if I can reach a few people and actually get people to see it a different way. As Dr. Mack says, it's like Dr. Jack's work is so deep, and I mean, he is who he is. He is not He's not everybody's cup of tea. And so I think it's going to take a few of us, people who are willing to go out there and start talking about it, to actually help make the message make sense for a few more people.
I agree. Doug, thank you so much for coming on.
Oh, thank you.
I appreciate it.